Duchenne muscular dystrophy, often referred to as DMD, is a severe genetic disorder that leads to progressive muscle degeneration and weakness. This condition primarily affects boys, with symptoms typically appearing in early childhood. Over time, the muscles gradually lose their ability to function, significantly impacting mobility and overall quality of life. Raising awareness about DMD is crucial, as early diagnosis and intervention can help manage symptoms and improve outcomes for those affected. Understanding this disease also supports ongoing research and fosters a more supportive environment for patients and their families. Duchenne muscular dystrophy is a genetic disorder caused by mutations in the gene responsible for producing dystrophin, a crucial protein that helps maintain the structure and function of muscle cells. Without functional dystrophin, muscle fibers are easily damaged, leading to progressive muscle weakness and degeneration. The gene for dystrophin is located on the X chromosome, which means the disorder follows an X-linked inheritance pattern. Since males have only one X chromosome, a single defective gene will result in the disease, whereas females with two X chromosomes are usually carriers and rarely show symptoms. This explains why Duchenne muscular dystrophy primarily affects boys. Early symptoms of Duchenne muscular dystrophy often appear in young children and can be subtle at first. One of the initial signs is delayed motor development, such as late walking or difficulty running and jumping compared to peers. Muscle weakness typically begins in the hips, thighs, and shoulders, making it hard for children to stand up from the floor. The Gowers sign is a classic indicator, where a child uses their hands to push off their thighs to rise. Additionally, calves may appear unusually large due to pseudohypertrophy, and as the condition progresses, children may experience increasing difficulty with mobility and daily activities. The diagnosis of Duchenne muscular dystrophy involves a series of important steps. Initially, blood tests are performed to check for elevated levels of creatine kinase, or CK, which can indicate muscle damage. Genetic testing is then used to identify mutations in the dystrophin gene, confirming the diagnosis. In some cases, a muscle biopsy may be conducted to examine muscle tissue directly. Clinical signs, such as delayed motor milestones and muscle weakness, also play a crucial role in early detection of the disease. Duchenne muscular dystrophy and Becker muscular dystrophy are both genetic disorders that affect muscle strength, but they differ significantly in severity and progression. Duchenne muscular dystrophy typically presents earlier in childhood and progresses rapidly, often leading to loss of mobility by adolescence. In contrast, Becker muscular dystrophy has a later onset and a slower, milder progression, allowing affected individuals to retain mobility for a longer period. Both conditions are caused by mutations in the dystrophin gene on the X chromosome, but Duchenne results from mutations that prevent any functional dystrophin from being produced, while Becker is due to mutations that allow for some partially functional dystrophin. This difference in dystrophin production is a key factor in the varying severity and course of the two diseases. Current treatments for Duchenne muscular dystrophy focus on slowing disease progression and improving quality of life. Corticosteroids are commonly prescribed to help preserve muscle strength and function. Physical therapy plays a crucial role in maintaining mobility and preventing joint contractures. Comprehensive care also includes monitoring and supporting heart and lung function, as these organs are often affected by the disease. In recent years, advanced therapies such as gene therapy and exon skipping therapy have emerged, offering new hope by targeting the underlying genetic causes of Duchenne. Recent years have seen remarkable progress in research and clinical trials for Duchenne muscular dystrophy worldwide. Several organizations are actively supporting these efforts, providing funding and resources to accelerate the development of new therapies. Innovative drugs, including gene therapies and exon skipping treatments, are currently being tested and have shown promising results in early studies. As research advances, the outlook for effective treatments continues to improve, offering hope for better management and potential cures in the future. Comprehensive care for children with Duchenne muscular dystrophy involves several key components. Physical therapy helps maintain mobility and muscle strength, while tailored nutrition supports overall health and growth. Regular monitoring and care of the heart and lungs are essential to address potential complications early. Assistive devices, such as wheelchairs or breathing aids, can greatly enhance quality of life. Equally important is psychological support for both the child and their family, helping them cope with the emotional challenges of the condition. Around the world, several organizations are dedicated to supporting individuals and families affected by Duchenne muscular dystrophy. These groups provide resources, advocacy, and guidance for accessing care and participating in research. Leading hospitals specializing in Duchenne treatment include centers in the United States, Europe, and Asia, offering multidisciplinary care and advanced therapies. Additionally, information about ongoing clinical trials is available through international registries, helping patients connect with new treatment opportunities. Staying informed about these resources can empower families to make informed decisions about care and participation in research. The Duchenne community plays a vital role in the lives of those affected by this condition. Families come together to share experiences, offer emotional support, and provide practical advice, creating a strong network of care and understanding. This sense of unity helps patients and their loved ones face daily challenges with greater resilience. Contributions from the wider community are essential, as donations enable access to treatments, resources, and support services that can make a real difference in the lives of Duchenne patients. In conclusion, patients with Duchenne muscular dystrophy continue to face significant challenges, from daily care needs to limited treatment options. However, recent advances in research and emerging therapies offer new hope for improved quality of life. Raising public awareness and fostering community connections are essential steps toward better support and understanding. By encouraging ongoing research and collaboration, we can work together to create a brighter future for individuals and families affected by Duchenne.